Hey guys, Dr. Morse, injury experts. Potentially big name injury here. Malik Nabers dealing with a toe injury. The stud second-year wide receiver for the Giants, who finished as the wide receiver 6 in PPR last year, had a monster season despite missing a game due to a concussion, as well as a couple other injuries, a shoulder and a knee injury. Now, if we go back in his injury history, we hear that he actually had a toe injury in college that we did not know about. Now, the tweet here shows us that he is dealing with a re-aggravation of this toe injury that does not need surgery and just needs a little bit of time off. It is unclear which toe it is. My guess it is the big toe, and we don't know which foot it's on, left or right. Now, let me give you a little bit of a deep dive into this. So traditionally, when we call a toe injury, they usually call it a big toe, almost always. So obviously this is the bottom of the foot. So when we traditionally think of a big toe injury that is a re-injury, the most common is a turf toe. Now, a turf toe injury often happens when the big toe gets sprained. Now think of the big toe as having almost like a balloon around it, and the bottom of the balloon, what we call the capsule, can get sprained. Now the capsule has a lot of nerves and there's not a lot of fat, so it's a bad combination, very painful. So when you try to step, the big toe is your balance center for your foot. So the problem is, if the big toe is injured, not only do you have trouble standing, but you also have trouble pushing off. And the problem is, when the turf toe is happening, it's very hard to push off with that toe and to be aggressive. And oftentimes there's swelling in that capsule. Now, if it's a mild grade 1, which is likely what it is, then it's just inflamed. They'll shut him down for a couple weeks and he'll be fine. If this is a grade 2, these guys really struggle. For those of you that remember, Devontae Adams had a grade 2 back when he was playing in Green Bay, and he missed a month. So these are big injuries. And so let's hope this is a whole lot of nothing. He tweaked it, and he doesn't need any surgery. He doesn't need any injections, and he will be fine in a couple weeks. He will return to off-season training, and then he'll start to ramp back up in August. There is obviously some risk here, though, because even though they're not talking about this being a big deal, these are notorious for re-injury. And if this indeed is a turf toe, we've seen someone like Antonio Gibson struggle with this throughout his career, and unfortunately, he's never really been able to truly get rid of it, and I believe he ended up undergoing surgery. So some guys really struggle with this. It's not a huge red flag for me, but it's definitely something to keep an eye on, that he's dealing with a toe injury, and hopefully get some clarity in OTAs. If this were regular season, he'd probably push it. The problem is, these only have a tendency to get worse because you're constantly curling your toes when you're running, stopping, starting. Some guys will even wear a carbon fiber insert in and around that toe, or in the middle of the foot if they're dealing with more like a Liz Frank. So these can be uncomfortable, and if you don't have your toe, you're not going to be a very effective route runner, which obviously is very important for him. So something to keep an eye on. His injury history is available at the Injury Experts. A ton of new content coming out. If you're trying to prepare for your draft, you can check out our content at theinjuryexperts.com. I will have a lot of videos, both on Twitter, on TikTok, as well as on YouTube. Thank you for tuning in. We will see you soon.